Hello friend, today we are going to talk about anesthesia drug. These are the 2 pages I will be going through, and this is a complete note of the anesthesia drug. Okay, first of all talking about halothane. Hello, first of all I'll talk about our this uh, halothane. Halothane has got sweet smell. It is stored in amber cotton bottle. It is preserved. The preservative used is 0.01 percent thymol. It is stored in amber cotton bottle because it reacts with the UV light. Okay, effect. There is bradycardia, hypotension. Everything is decreased. Okay, bradycardia, hypotension, but this IOP and BP is also decreased. But ICT, intracranial tension, is increased. It sensitizes myocardium to this arrhythmic effect. Okay, halothane, bradycardia, hypotension, decrease IOP and BP, but it sensitizes myocardium to dysrhythmic effect, and there is increased intracranial tension also. Disadvantage of halothane are halothane sake is there, hepatitis is there. This is most important thing. Halothane sake and hepatitis. This is most important thing in case of halothane. And this malignant hyperthermia is another thing. In halothane sake, the treatment of choice is our pethidine. Pethidine is the treatment of choice in case of our halothane sake. Okay, hepatitis in halothane occurs if we give repeated halothane within 3 months of duration. Okay, since it is our halothane is a muscle relaxant, if we give in case of this during delivery or during CS, it can lead to PPS. Okay, increased chance of PPS there. It is strongly contraindicated in case of our pheochromocytoma. Now talking about trine, only one thing we have to remember: trine is a knob poison. Okay, knob poison. It acts on the 5th and 7th cranial knob. It acts as a knob poison in 5th and 7th cranial knob. It is so in case of trigeminal neuralgia, we inject it in the knob only. Okay, and it is cardio stable. Now talking about chloroform. Chloroform, only one thing you have to remember: it causes our ventricular fibrillation. Okay, ventricular fibrillation. It is cardiotoxic. Ventricular fibrillation it can cause. Internox is a 50-50 mixture of N2 and O2. Okay, N2O and O2. It is like used in our daycare surgery, like in case of wound dressing, chest physiotherapy, removal of chest drain, labor analgesic, and dental surgeries. Okay, they are all for short procedures. We can use internox, mixture of N2 and O2. Okay, now helium is, here we have to remember one mixture. This is heliox is a mixture of 79% helium and 21% oxygen. 79% helium and 21% oxygen. Okay, since the mixture of helium and oxygen is lighter than air. Okay, it is lighter than air. It goes upward. Okay, lighter means it goes upward, so it's useful in case of the upper airway. The upper airway obstruction, you can use this helium. Okay, heliox mixture, heliox. Xenon has got low BG means blood gas coefficient. Okay, if it BG coefficient is low, it has got fast induction and fast our recovery. Okay, BG blood gas coefficient ratio is lowest in xenon, so it has got fastest induction and fastest recovery. Now talking about our N2O. Okay, N2 is also known as our laughing gas. Okay, laughing gas. N2 is laughing gas. Uh, it has got lowest potency and efficacy. The MAC value is our 105. MAC value is 105. 105. So we give excess concentration. Okay, if we are using our N2O, then since the MAC value is 105, we have to use excessive concentration. Like there is no place for oxygen to use. Okay, so it's got poor anesthesia. The induction, sometimes the question is asked, Why the induction is fast in case of N2O? Because of concentration effect. We have so much of concentration. 105% max is there. Max is there. It has got fast recovery. Okay, because large concentration is required for this action. 105% max value is required. That max value may not be available. So now it has got it is safest anesthesia, and it is non-irritant and non-inflammable. Okay, these are also important in case of during past, while they were using this anesthesia, there was not good anesthesia setup. So at that time, non-irritable, non-inflammable was a major property they used to search. Three things you have to remember in case of NTO is it is a bone marrow. It suppresses bone marrow. Okay, first it has tendency to expand in closed cavity, and diffusion hypoxia is there. Okay, bone marrow suppression. If a person comes after our 2-3 months of our anesthesia of major surgery, if a person comes after 2 months with anemia, like a plastic anemia, okay, we have to think about bone marrow suppression due to N2O. Okay, tendency to expand in closed cavity. It has got tendency to expand in closed cavity, so we do not give this N2O in case of our pneumothorax, intestinal obstruction. With this closed cavity, we do not give this. Diffusion hypoxia. Hypoxia is also known as filling effect. Like while recovery, the N2O can come back to the alveoli. Okay, can diffuse back to the alveoli and cause hypoxia. This is known as filling effect. Now talking about ether. Ether is like emetic. Okay, ether is emetic. Ether is our emetic, and it has got expansal property. Ether is emetic. It is explosive, unpleasant, and pungent. Okay, ether, emetic, explosive, and unpleasant property. Okay, low boiling point. It has got very low boiling point. It boils at around 15 degree or something like that. At room temperature, if we apply it, it cause like denervation by freezing. Okay, due to latent heat of vaporization, it vaporizes and it makes the surface so cold, like it causes denervation by freezing. Okay, agent with maximum skeletal muscle relaxation property and good analgesia. Ether is agent with maximum skeletal muscle relaxation property and good analgesia. Now talking about methylfluorine. Methylfluorine has got a high fluoride content. Okay, high fluoride content, so it causes vasopressin resistant high output renal failure. High fluoride content, due to which it causes high output renal failure. Okay, vasopressin resistant high output renal failure. Now talking about this, like which are favorable, which are mostly used, which are like favorable, which mostly used in this case, like in neuroanesthesia, isoflurane is used. Okay, isoflurane is a choice of anesthesia in case of neuroanesthesia. In case of cardio anesthesia also we use isoflurane. Hepatic anesthesia also we use isoflurane. In pediatric we use ceflurane. Okay, ceflurane, uh, ceflurane, so like save the child, they tell like save the child. Oh, neuroanesthesia we use isoflurane. In cardio anesthesia we use isoflurane. Hepatic anesthesia we also use isoflurane. Isoflurane, then desflurane. Okay, in pediatric surgery we use sevoflurane. Sevoflurane is like favorable. We use a choice of anesthesia in case of pediatric anesthesia. In day care surgery we use desflurane. Desflurane is day. In asthma we use halothane. Okay, influrane, one thing you have to remember, influrane is epileptogenic. Okay, influrane is epileptogenic. Desflurane, I already told you, desflurane is used in daycare surgery. Okay, daycare surgery. And anesthesia of choice in renal failure patient, geriatric patient, and daycare surgery. Isoflurane like is mostly used is anesthesia of choice in cardiac surgery, neurosurgery, and liver transplantation. Cardiac surgery, neurosurgery, and liver transplantation. Okay, neurosurgery, there is minimum increase in intracranial, like intracranial this tension, so it is seroprotective. Okay. Liver transplantation, it used in liver transplantation because it maintains hepatic venous oxygen saturation. It maintains hepatic venous oxygen saturation, so isoprene is used in case of our liver transplantation. Now talking about IV anesthesia, IV anesthetic drug. Okay, first of all, thiopentone. Okay, thiopentone is used in concentration of 2.5%. 2.5% concentration IV thiopentone is used. If concentration of less than 2.5% used, then the patient is aware. Okay, there is awareness. While if we use greater than 2.5%, there is pain. There is pain and necrosis at the site of injection. Okay, so concentration we use is 2.5% concentration is the maximum we can use. Okay, while giving thiopentone, give in outer aspect of forearm. We have to give an outer aspect of forearm. Remember, outer aspect of forearm. Okay, it is cerebroprotective. It is cerebroprotective because there is minimum change. It decreases the ICP. Okay, it decreases ICP with cerebral anesthesia, with cerebral metabolism. Oxygen demand is decreased. Okay, so anesthesia of choice in case of head injury, and it is also used as anticonvulsant. Okay, it decreases interconnect pressure with our cerebral metabolic oxygen demand. It decreases also cerebral metabolic oxygen demand, so it is used as an anesthesia of choice in head injury and anticonvulsant. Now talking about ketamine. Ketamine is also known as dissociative anesthesia. It is profound analgesia. Okay, pain control, profound analgesia. Okay, advantage is it can be used in full patient. That is, if a person has just eaten, we can also use it because it like this respiratory tract, this upper respiratory tract reflex is reflex is intact in case of our ketamine use. His upper respiratory tract reflex is intact, so we can use in our full patient also. It is potent bronchodilator. It is a potent bronchodilator. Sympathetic stimulation. Due to sympathetic stimulation, it increases heart rate, BP. Okay, it is a drug of choice in case of hypovolemic shock. Hypovolemic shock, ketamine is a drug of choice because it increases blood pressure. Okay, disadvantage, it increases all pressure. Decrease like ICP, it increases ICP. It increases intraocular pressure. It increases BP. Okay, BP. So it is avoided in case of ischemic heart disease and coronary artery disease patients. Okay, it increases ICP, so it is there is non-purposeful limb movement, dreaming, hallucination, nystagmus, and emergent reaction like dreaming, hallucination, nystagmus. Okay, non-progressive, non-purposeful limb movement. In case of while there is withdrawal of this ketamine, in this case emergent reaction, we give midazolam. We sedated the patient with midazolam. Okay, now talking about propofol. Propofol is is used in our daycare surgery. Okay, maximum depression of upper airway reflex is there. Maximum depression of upper airway reflex is there. So drug of choice for LMA insertion. Okay, whenever they will ask you what is the drug of choice for LMA insertion, the answer is propofol. Okay, dose dependent myocardial suppression is there. In case of propofol. Okay, one thing you have to remember, it causes egg allergy. Okay, egg allergy because it contains egg thing. It causes egg allergy. Dose dependent myocardial suppression is there, which leads to hypotension and bradycardia, decreased BP and decreased ICP. Propofol. Okay, decreased BP and decreased ICP. Now talking about etomidate. Etomidate is a cardioselective. Okay, it is anesthesia of choice in case of aneurysm because there is no increase or decrease of heart rate. So anesthesia of choice in case of aneurysm. Okay, aneurysm surgery and patient with cardiac disease. Okay, there is maximum potential of having nausea and vomiting. It causes suppression of adrenal cortex. Etomidate. Okay, now talking about fentanyl. One thing you have to remember, fentanyl is causes chest tightness. Okay, chest tightness. Whenever they use fenta, during induction it may cause our chest tightness. Okay, Ramifentanil is a opioid, ultra short acting, used along with propofol in TIVA, total intravenous anesthesia. It is a opioid. Ramifentanil is a opioid, ultra short acting, used along with propofol. Ramifentanil used along with our propofol in total intravenous anesthesia. Ramifentanil. Sufentanil is the most potent. Sufentanil is the most potent. Maximum plasma binding is there. Sufentanil is most potent. Sufentanil is most potent. Most potent. Maximum plasma binding is there. Okay. Now talking about our amide and ester. Amide and ester. This our local anesthetic with amide and ester. Amide is hydrolyzed in liver. Okay, ester is hydrolyzed by plasma cholinesterase. Okay, except cocaine. There is high incidence of allergic reaction due to degradation of our PAVA. High incidence of allergic reaction due to degradation of PAVA. Cocaine, chlorococaine are the example of ester. Ester is hydrolyzed by plasma cholinesterase. Okay, the example of amide is lignocaine, prelocaine, dubicane. We can know amide group because there is I before cane. Okay, I before cane like uh, this dibucane, lignocaine. I is also two I are there. So lignocaine, prelocaine, dubicane. In this way we can know it is a amide group, and amide group is hydrolyzed in liver. Okay, ester is hydrolyzed by plasma cholinesterase, and is high incidence of allergy in case of ester. Allergy in case of our ester, and it is metabolized hydrolyzed by plasma cholinesterase. Okay, ester, allergy, cholinesterase. Okay, now talking about muscle relaxant. We're going to the short description is about muscle relaxant. Okay, muscle relaxant like muscle relaxant. There are two type of muscle relaxant: non-depolarizing and depolarizing. Non-depolarizing can be divided into long acting, intermediate acting, and short acting. Long acting, intermediate acting, and short acting. Long acting like long acting non depolarizing muscle relaxant are D-tubocranine and pancuronium. D-tubocranine and pancuronium. Long acting muscle relaxant. Long acting non depolarizing muscle relaxant D-tubocranine and pancuronium. Intermediate muscle relaxant are vecuronium, etracurium, and rocuronium. Vecuronium, etracurium, and rocuronium. Short acting are mivacurium and rapacurium. Okay. Intermediate are vecuronium, etracurium, and rocurium. Okay. Short acting is mivacurium, rapacurium, and rapacurium. Shortest acting is suction alcohol. Shortest acting depolarizing. Only one you have to remember, suction alcohol. Suction alcohol, it is shortest acting. Okay, shortest acting. Now talking about suction alcohol. The drug is dose is 1 to 1.5 milligram per milligram. 1 to 1.5 milligram, and our onset of anesthesia occur in 10 to 30 seconds. Duration of action is up to 3 to 5 minutes. Okay, 3 to 5 minutes duration of action. Okay, and dose is 1 to 1.5 milligram. 1 to 1.5 milligram, and onset of anesthesia occur in 30 to 50 seconds, and duration is 3 to 5 minutes. Succinylcholine normally cause phase 1 block. But large doses can produce phase 2 block also. Okay, both phase block can be caused by succinylcholine. It can be given in myasthenia gravis. And myasthenia gravis, but it avoided in DMD. But it avoided in Duchenne muscular dystrophy. Causes hypokalemia. Succinylcholine causes hypokalemia. So side effect, it can cause post-operative muscle soreness or myalgia. Post-operative muscle soreness and myalgia due to our succinylcholine. Okay. Now talking about mivacurium. Mivacurion is a shortest acting non-depolarizing muscle relaxant. Shortest acting non-depolarizing muscle relaxant. It's metabolized by plasma cholinesterase. Plasma cholinesterase. Plasma cholinesterase can be used in continuous fashion. Can be used in continuous fashion. Tetracurium. Tetracurium is safe in renal and hepatic patients. Safe in renal and hepatic diseases. There is because there is Hofmann degradation. Okay, Hofmann degradation. Hofmann degradation means the drug is converted to or it is metabolized to laudanosine, and the laudanosine is excreted by its own. Okay, there is Hofmann degradation. Rocuronium. Rocuronium. Only one thing you have to remember. Rocuronium called painful is painful and used for rapid suction intubation. Okay, rocuronium is painful. At tetracuronium, allocuronium only muscle relaxant which causes anaphylactic reaction. Anaphylactic reaction caused by this. Okay, D-tuboculanin requires reversal with neostigmine because it's very long acting, so it needs neostigmine for reversal. Okay, thank you this much for today.